There are two things that we're interested in. One is joint mechanics, and one is early detection of changes in the cartilage. The reason that we're interested in those two things is because they're both very important in osteoarthritis, which is one of the most prevalent musculoskeletal diseases that there is.
Someone with osteoarthritis has problems carrying out activities of daily living, such as getting in and out of the car, going up and down stairs, any cleaning around the house. And the reason for this is that they often experience joint pain, joint stiffness.
And unfortunately, it's really hard to relate pain to a lot of the measures we can get, like imaging measures and cartilage health measures. So it's actually quite challenging to do something that's relevant for the patient. Osteoarthritis
progresses by thinning the cartilage and by the cartilage losing volume. So by being able to actually measure the thickness and the volume, we can quantify the change that happens with osteoarthritis, and that's something we just can't do with an X-ray.
So we can look at cartilage morphology, which is the thinning of cartilage, and cartilage health in terms of the molecule depletion through the joint. And so what I want to do is I want to combine those measures of cartilage health with our measures of joint mechanics and see how they're related to one another.
We have a new MRI scanner that is different from any other MRI scanner in Canada. And the way that it's different is it lets people stand up and move in weight bearing. That is, move through normal activities of daily living, but we can still image them just like we can in a standard MRI scanner.
We take those models and we can match them up to the low resolution scans, which are taken at the 6 different angles of knee flexion, and then we can figure out the relative positions of the bones from that.
So Laura has been working with a very advanced MRI unit that we have here at UBC and has been able to visualize cartilage deforming as she loads it up. And she has been using that new technique to assess 2 different approaches to dealing with problems that people get at the hip.
The labrum is a structure in the hip, and it's a fibrocartilaginous structure, and it surrounds the periphery of the hip joint. A labral tear leads to osteoarthritis, or it's thought. And then the next step for those patients who have osteoarthritis is to get a hip replacement. The aim or the motivation of my research is to find the gap between the labral tear and the osteoarthritis, and how can we better alleviate the pain from a labral tear while minimizing the risk of developing osteoarthritis in the future. Probably
the strongest type of collaboration we have involves having an engineer work with a surgeon. So most of my graduate students are engineers, usually with a background in mechanical engineering or systems design engineering or computer engineering.
I personally work with surgeons and MR physicists and sometimes physiotherapists. Everyone has their expertise from the area, and we all come together and work on the same problem from different points of view.
Yeah, I really enjoy working with surgeons because it's my goal to produce research that's clinically relevant. The ability to get their perspective on a research proposal is priceless to me in order to assure that this information will be valuable to the clinical audience.
Working with patients, you see the human face to these problems, you know. For example, this one guy, he's 35 and he doesn't have any cartilage left on one side of his knee. And you see that that's an issue. I mean, he's in pain and there's nothing he can do about it. So it definitely is motivating. You know, you see, wow, there are real people I could help by my research. You go through 4 years of undergrad or 4 years of medical school and you learn to look at things a certain way. That's part of the training. And yet, it's helpful when people can look at things from another direction and say to you, well, have you thought of this? And it's just a fantastic environment to work in.
Every new perspective adds something in defining the research question, in dictating how the research should be carried out, and interpreting the results. So that's a very valuable aspect of the CHH.